We often tend to use the words emotions, feelings, moods, and affect interchangeably, which creates confusion in both conceptual and methodological domains of tourism and hospitality research. At the same time, the insights from neuroscience and psychology demonstrated that there are fundamental differences between these concepts, including their causes, duration, intensity, and outcomes. Emotions are described as physical states or neurological reactions to a specific response to external stimuli, while feelings are mental reactions to emotions, which are influenced by personality and temperament. In contrast to emotions and feelings, the mood is a conscious state of mind, which is less likely to be provoked by particular stimuli. Meanwhile, affect is just an umbrella term comprising a broad range of human states, including emotions, feelings, and moods. The main distinguishing characteristics are causes, intensity, duration, and outcomes. Emotions are usually caused by a specific stimulus like an event, a person, or an object, and originate in the limbic system of the brain, while feelings are the product of the activity of mental areas of the brain, assigning a certain meaning and interpretation to precedent emotions. Therefore, emotions are quite immediate, intensive, and very brief in duration, while feelings are less intensive and need a longer time to emerge and disappear. In contrast, moods are less intense, less specific, last for several hours or even days, and do not attributable to a specific object or stimuli. Since emotions are momentary and accompanied by psychophysiological responses, the best way to measure them is to apply the moment-based methodology, including electrodermal activity, electrocardiography, pupillometry, and event-related potentials. In contrast, feelings are cognitive interpretations of emotions, events, and sensations could be measured verbally by using self-report scales and interviews. Mood changes can also be evaluated by using scales with consideration of the average level of mood and mood reactivity. I think future research needs to analyze the relationships between tourists' emotions, feelings, and moods, as well as their antecedents and outcomes. Different emotional states might be influenced by tourists' specific responses to external stimuli, customers' perceptions, cognitive evaluations of events, and other factors. Furthermore, interrelations between emotions, feelings, and moods could work both ways. The emotions evoked by tourism experience or external stimuli might cause subsequent cognitive evaluations and result in positive or negative feelings and moods. At the same time, thinking about some positive or negative events may cause emotional responses. In addition, capturing the instant and dynamic nature of tourist emotions by using psychophysiological and momentary assessment techniques will bring important theoretical implications and contribute to practice by evaluating and designing better experiences.